Today we're talking diabetes. That's a topic I have to be honest with you, I know nothing about. Now we have two professionals. They'll be answering questions. Now I have Dr. Adeola Akindana. Dr. Adeola Akindana holds a Doctor of Nursing practice degree. She specializes as a diabetes nurse practitioner and also a certified diabetes care and education specialist. She's been doing this for since 2005. She has dedicated her nursing career to caring for people living with diabetes. She has worked in various capacities, including diabetes research, inpatient and outpatient care, capacity building in developing countries. Dr. Akindana's interest is in increasing cultural competency and health literacy in optimizing patients' experiences and also educating other professionals on developing cultural humility around providing patient-centered care. That tells me one thing: she's a voice for diversity, equity, and inclusion in her profession and patient care access. She has served on the board of the Association of Diabetes Care and Education Specialists. Dr. Akindana is a prolific speaker and presenter to professional and layman audiences nationally and abroad. And that's exactly why we're here talking to Dr. Akindana. Dr. Akindana works with University of Maryland Capital Region Medical Center in Largo, Maryland. And she will be a guest alongside Teresa English. Teresa English is an inpatient diabetes educator at University of Maryland Capital Region Medical Center in Largo, Maryland. Teresa has been a nurse for 30 years and has also worked in a variety of settings. Now, about 3 years ago, she came to Capital Region Medical Center to learn about diabetes from Dr. Akindana. Her long-term goal is to move diabetes education from the hospital to everyday life, working in a diabetes cafe, promoting a healthy and stable blood glucose level, keeping people out of hospital. Yes, so it's my pleasure to bring to the podium, to Mustbe5radio, Dr. Adeola Akindana and Teresa English. You're welcome, ladies.
Thank you very much.
And thank you for taking your precious time to be with us this Sunday. You could be home enjoying with family. How are you ladies doing today?
Very well.
Thank you. Thank you.
Fine. Thank you.
Thank you. So I have Dr. Adeola Akindana and Teresa English. My first question goes to Dr. Adeola Akindana. What is diabetes? I don't know what it is. What is diabetes?
Well, good Good day to your audiences wherever they are. Good morning, good afternoon, good evening, good night. And thank you for joining us for this session today. What is diabetes? Diabetes is a cumulative disease that actually affects the body when our body is no longer utilizing insulin properly, is not able to use it properly, or there is what we call insulin resistance, and the blood glucose continues to rise in response to foods that we eat.
Thank you so much. You mentioned insulin, right? I don't think anybody ever told me I have insulin. And my doctors never said anything about insulin. What is insulin?
Oh, very good question. So, our body actually makes insulin. We
Okay.
have different organs in our body. We have the heart. I think a lot of people are familiar with that, and the lungs and kidneys, liver.
Okay.
But oftentimes people are not aware that we also have another organ called the pancreas. And the
Okay.
pancreas is responsible for making insulin. So you could think of insulin as the key to open the door. So when we eat, food is used for nutrition in our body. So it breaks down and releases glucose into the bloodstream. And so we need the pancreas to respond to that and produce insulin that then opens our blood cells, and move that glucose or sugar, either one you could use interchangeably, and moves it from the bloodstream into the cells where it stores it for future use.
Okay. So we can say insulin and blood sugar are the same thing. Is that correct?
They work hand in hand.
Okay. All right. Thank you so much for that. So we just want to understand diabetes, what it means, how it affects people. My next question goes to Teresa. Teresa, I'm sure I cannot get diabetes because I'm just positive. I'm a positive person and I know I cannot get diabetes. Who can get diabetes?
Who can get diabetes?
Yes.
Diabetes is, well, there's several different factors that increase your risk for getting diabetes.
Okay.
There's not one particular risk factor that if you have it, you will definitely develop diabetes. But as you get older, your risk goes up. For whatever reason, men are at a higher risk than women. If
Interesting.
family members have diabetes, there is a genetic component, and that will increase your risk. Certain ethnic groups are also at higher risk for developing diabetes. And also, as people gain weight, if they do have a genetic predisposition to diabetes, that will also increase their risk.
Okay. Thank you for that. So you're saying certain race races can get more prone to diabetes. Is that correct?
That is correct.
Can you shed some light on that, please?
I will, and also I will refer your listeners to the CDC, and they do
Okay.
have a diabetes risk quiz. And you answer those questions, and then that will give you a score and tell you your risk of developing type 2 diabetes. But
Okay.
certain ethnic groups are at a higher risk. And Dr. Akindana, I will have you jump in on this one. I know that the African American population is at a higher risk. The American Indian population is also at higher risk.
Right.
And the Asian ethnicity, because I guess they tend to be much slighter, that their risk of diabetes actually increases at a much smaller weight. So typically, once your BMI goes above 25, your risk for type 2 diabetes increases. But for people of Asian ethnicity, if their BMI goes above 23, you see an increased risk. And please jump in, Dr. Akindana.
Dr. Akindana, let's hear from you.
Yeah. I think Teresa has really laid out very important factors, but I would just add to that. Um, First, to explain BMI, I think we often hear what that is, but it's looking at our weight compared with our height and gives us a number that lets us know, based on the height, what should the weight be and if we're overweight or if we're obese. In terms of those who are at risk, as she had said, the American Indians at higher risk, African Americans, Latino and Hispanics are at higher risk, and also Asians are at higher risk than other groups. In addition to that, people who are more prone to diabetes, people who are overweight, who are obese, who have uncontrolled hypertension, or they may have kidney disease, those who tend to consume high fat, high carb diets,
Okay.
um, they also have increased risk, because obviously with eating high fat, high carb diets comes being overweight and obese. So, and she has also mentioned correctly that it's familial as well. So if you have maybe your mom, dad, or siblings, or your grandparents, and this is why it's again important for us to know our family history.
Right.
um, it increases the risk. It doesn't say you're gonna get it, but the
Hmm.
risk is definitely becomes a whole lot higher.
Interesting. So I'm originally from Ghana in West Africa, right? I enjoy my occasional Sunday fufu and palm nut soup, right? Can that help? Because my grandmom told me that's healthy. It's gonna make you strong. Does that help, or does that make me prone to diabetes?
Well, maybe not in and of itself.
Okay.
So I know we tend to attack fufu a lot. I work with a lot of Africans, and they say, "Oh, I shouldn't eat fufu, or I shouldn't eat rice, or I shouldn't eat bread, or I shouldn't eat pasta." All these foods we do need, they're all considered carbohydrate foods,
Okay.
and we do need some carbohydrates, because that's the carbohydrate that turns into sugar,
Right.
and which is our energy source. It's like trying to say, oh, I'm not going to put gas in my car. Your car is not going anywhere.
Right.
But then, you have premium gas, and then you have the, regular
The regular.
gas. So you may decide, okay, I want to buy premium gas. So then that talks to the quality of food that you choose to
Mustbe5radio.
eat, and then the portion that you choose to eat. So that's where we start to get into trouble, is that people tend to not eat as much vegetables and not non-starchy foods, and we tend to lean more towards carbohydrate meals, and which that's part of the problem. Not so much that you can't have them, but you need to understand how much of it you can have, the portion control, and things like that.
Okay.
And if you don't know, you could either look it up, or meet with a dietitian that could teach you how to, read food labels, so
Right.
that you understand better your portion control.
Thank you so much. What I understand there are types of diabetes, right? What types of diabetes are there? This is for Dr. Kinda now.
Okay. So there are different types of diabetes. The most common that we hear about is type 1 diabetes, type 2 diabetes, and gestational diabetes. We also have some that are genetic based diabetes. However, type 1 diabetes is more of an autoimmune disease, where the body fights itself and actually kills what we call beta cells. The beta
Okay.
cells are what makes insulin in the pancreas. So over time, they no longer have those cells, and they have inability and unable to make insulin. it's only about 5 to 7% of population that has type 1 diabetes. The majority of people have type 2 diabetes, so about
Okay.
95% of people. And type 2 diabetes is cumulative of multiple things, as Teresa had said earlier, being overweight and obese, your race, your gender, um, your predisposition, if you're physically active or not. All
Hmm.
those plays into the role of one being at higher risk of developing type 2 diabetes. The other type of diabetes that is also equally common is what we call gestational diabetes.
Okay.
And that basically is when the woman develops diabetes while pregnant. So that's why when the woman is pregnant, they usually would do like a glucose test along the way to make sure that their blood sugar is still well controlled. Now, many people would go back to normal after they've had their baby. However, that's the first telltale sign that they are at risk of
Right.
developing diabetes later in life. And it's important that after they have their baby that they do get tested at interval, that they do not have or develop that type 2 diabetes at that point. A woman also that's had a baby that is, you know, greater than 9 pounds. And in our culture, when you have a 9 pound baby, we all celebrate. Look at how big this
Big
baby
baby,
is,
right?
and blah blah blah. Exactly. Most likely they had gestational diabetes, and that's one of the downside. The baby, you know, consumes more sugar from the mother, and
Right.
that's why they gain weight excessively. So that should also be an indication, if you have a large baby, to get tested for diabetes down the road after that. And when I say down the road, when you go 6 weeks after you have your baby, you should get tested.
Right.
And then at least between 1 to 3 years, depending on other risk factors, you should continue to get tested so that you can catch it early.
Okay. This one is for Teresa. Dr. Kindana is talking about getting tested for diabetes. What kind of tests are out there? Say, after having this conversation, I decide tomorrow I want to get tested for diabetes. Where do I go? How do I get tested? And let's say there's a lady listener who just had a baby. Are there different kinds of tests that's available out there? Can you talk to us, Teresa, about this?
Yes. The recommendation from the American Diabetes Association is for adults now at the age of 35, when they go for their annual physical exam, to have a blood test, which is a screening test, and it's called the hemoglobin A1C. That is what I would recommend for the general population at the age of 35, and every year when you go for your physical exam. And what that test looks at is the amount of sugar that's stuck to your red blood cells. Your red blood cells live for about 2 to 3 months. So as they're traveling around in the blood vessels, depending on how much sugar is in the blood vessel, a certain amount will stick to it, kind of like glazing a donut. And so when the doctor orders an A1C test, they're looking to see, okay, how much sugar is stuck to these red blood cells. And because those cells live for 2 to 3 months, it now gives the doctor a big comprehensive view as to what's been happening in the body over the past 2 to 3 months.
Right.
So when you're pricking your finger, you're just looking at a moment in time. The A1C is a much broader view, and that's what I would recommend. And then Dr. Akindana was talking about tests that are done when a woman is pregnant,
Right.
and that's a oral glucose tolerance test, as well as checking that blood sugar about 6 weeks after delivery. And Dr. Akindana, is there anything else you wanted to add?
No, I think you're very right that the A1C test, I mean, to understand clearly, when you do go for any of these tests,
Right.
there are multiple criterias that defines who can be um, diagnosed with diabetes. Many of the tests, if the person has um, other symptoms, um, clinical symptoms, like maybe they've been having excessive thirst, excessive urination, excessive hunger, and then their A1C is high. And when we say high for diagnosis,
Right.
that's A1C that is greater than 6.5. I often tell people and my patients that diabetes is a numbers game. So there's a lot of numbers surrounding the diabetes. And again, the oral glucose tolerance test is something else that they would do. And based on if it was a fasting test, and then what your number was 2 hours after, we will also let them know, yes, are you able to, because the oral glucose test is basically trying your body, for lack of a better word, to see how do you um tolerate glucose. So when you're given glucose, or when you eat something that is sweet or carbohydrate that breaks down, how does your body digest that, tolerate it, and is able to absorb it within 2 hour period? So they will
Right.
do also that test, and we have numbers, like I said, of what is you don't have diabetes, what is you have pre-diabetes, versus what it is that you have diabetes. Now, the guidelines does say that they should be done at least on two different occasions. So you do it the first time, and then you have to go back
Okay.
and be retested for confirmation before you can be diagnosed as someone who has diabetes.
Thank you. Thank you so much.
Yeah. And Mike,
Yes,
can I add one more thing on
please
that
do.
just thinking about as she was speaking, the other reason the A1C test is so important is it will actually give the patient as well as to the doctor a heads up if that blood sugar is beginning to rise.
Okay.
Type 2 diabetes usually develops over several years. And if
Yeah.
you can catch it as it's on the rise, they have diabetes prevention programs throughout the country, low cost, no cost, that have been shown to reduce your risk of developing diabetes by about 58%. So these programs are wildly successful, but the key is identifying the people and getting them in.
And
Thank
being
you.
persistent and consistent with the care as well is
Mhm.
Right.
also critical.
Right. Okay. So we talked about going to your primary care for a physical exam, and then having a blood hemoglobin A1C. Now, I've been to my primary care a couple of times, where they take my blood. They squeeze my arm and they take my blood. Is that test taken out of that, whatever blood is taken from there, or it's a different test? This is
Not
to Dr.
necessarily.
Kindana.
So when they draw your blood,
Yes.
the doctor could be doing that for various reasons and looking for various things.
Okay.
So your doctor or your provider, your primary care person, or wherever you go, um, actually have to request for that A1C test. And actually, they even have home kits now that people could buy. And I really didn't look into that. Sorry, but maybe as we go on, I can try to see if I can get some information.
Okay.
But you could go to your provider, or you can actually do a home kit, but you might not know how to interpret the results. So I
Right.
would say it's advisable to go to a professional. And aside from that test, which Teresa alluded to, and I wanted to talk a little bit about, is the risk. So there's a 60-second type 2 risk test that anyone can do. It's online. You could go to the American Diabetes Association diabetes risk test.
Right.
If you Google that, it pops up, and you can just do it online. Um, and put all your information. It basically asks your age, your gender, if you've ever had gestational diabetes, if there's any immediate family member that has diabetes, if you have high blood pressure, your physical activity level, race or ethnicity, and the BMI that we talked about. So it asks all those questions and kind of gives you a score. And if you have a score of 5 or higher, that tells you that you had increased risk for type 2 diabetes. And I think that that's a very good time for you to go to your doctor and say, oh, well, I did this online. I heard I
Right.
could do this. When I did it, and my score was greater than 5. If you don't do that, when you go for your next physical, you should ask your doctor, am I at risk for developing type 2 diabetes? And they should ask you these similar questions. And if that is the case, you should request. So this now is about self advocacy. So
Right.
you should request that the doctor does a A1C level for you.
Must be
Even if they
5
say you're at
radio.
low risk, just say, I want to know my baseline. If you're over 35 years old, you could request that for sure.
Interesting. So age definitely plays a role, right, in getting diabetes. 35 and up, you should request, to see your hemoglobin A1C numbers, correct?
Yes.
Right, because as Teresa alluded to be honest with our listening audience,
Right.
sometimes it takes 10 years before people start to show symptoms of diabetes, which they've been exposed to high sugars or even undiagnosed diabetes for that long, especially for people. And I think that's why it's even more prevalent in men than women, because they tend not to go to see the doctors, right?
Right.
And so they could just, the first time they might hear that they have diabetes is when they end up in the hospital because they were feeling sick, or they had a wound that wouldn't heal and they had to go to the hospital. And that's when they tell them that, oh, you have diabetes. So definitely it's really important that you have that conversation with your doctor. You find out your baseline, and if you're at low risk, then you could is not unreasonable to request a test every 3 years. If you're at a higher risk, then you want to at least do maybe once a year. And as Teresa also educated us to learn, how do I reduce my risk? If I'm at pre-diabetes, how can I um, turn that around, delay or slow down developing diabetes? Because again, there's been so much studies and research around this area, and it is doable and possible.
Thank you so much. Thank you so much for devoting your lives to the study of diabetes and passing this information out. I know you touched on it, Dr. Akindana, but what are some health conditions caused by diabetes? Can you just stress that again? Because I feel like that is so important for our listeners to know and to understand what we're talking about and dealing with. What are some of the health conditions caused by diabetes?
Well, diabetes is a manageable disease. Even though I'm not gonna lie to you that it's not as easy as it sounds, but it is manageable,
Okay.
and it comes with a lot of risk of complications. And I believe that oftentimes people do not take diabetes seriously because it's kind of an upside down disease, in the sense that when people have diabetes, oftentimes they don't have any symptoms. They don't know. They feel the same. They might feel tired and fatigued and irritated sometimes. And, when somebody does something to them, they just lash out, and, they justify lashing out that, somebody bothered me and I'm angry, and so I should be able to express myself. But a lot of that irritation actually um, is related to all this high blood glucose that might be persistent in their bloodstream and things like that. And so if it's not managed properly, if it's not brought under good control, you start to see. And again, these are things that happens insidiously, slowly, where people are not even aware that it's going on. The kidney function begins to diminish, where over time they can end up with kidney disease. And if it's not controlled and taken care of, can even end up with end-stage renal disease where they end up on dialysis, and would have to be on that for the rest of their life. It is also the leading cause of blindness,
Right.
the leading cause of non-traumatic amputation. So it's not like someone had an accident and then they had to amputate their foot or anything like that. This is because it's damaged their nerves. They're unable to feel sensation any longer, and they may step on something as simple as a nail and not aware of it. And it starts to get infected, but because they don't feel pain, they don't even realize it until it's too late. And when they go to a doctor, now they say, "Oh, we have to amputate that toe or the leg or whatever the case may be." It also increases the risk of stroke and heart attack, because the twin of diabetes is hypertension, high blood pressure, and so that's also another risk that can happen. So it's a lot of bad things that happens to good people
Right.
when they are not diagnosed early enough, when are not controlling the disease appropriately, and are exposed to these complications over a period of time.
Interesting. So, Dr.
And
Kindana, yes, Teresa, go ahead.
Go
oh,
ahead.
I wanted to say I started at the hospital with Dr. Akindana about 2.5 years ago, and
Right.
I'll never forget what she said when I first started. She said, "Here is where we treat the comorbidities of diabetes." And it just hadn't occurred to me. Everybody coming with strokes, with heart attacks, with non-healing wounds, needing dialysis. That's what was going on. A lot of these hospitalizations were caused from years and years of uncontrolled diabetes. So that made a huge impression on me. And one other thing I wanted to say was we had a patient that we promised him that we would share his story. He was losing a toe, after, just like Dr. Akindana was saying, he stepped on a carpet tack. I think he was having carpeting changed in his home.
Right.
He didn't feel it. He ended up losing a toe. And he had
Must
had
be five
diabetes for
radio.
years. He took it seriously. He didn't take it seriously. He kind of went back and forth. And he said to us, "They always told me to get my A1C under 7. They never told me why." And that is something that Dr. Akindana continuously stresses. Once people understand the purpose to the treatment plan, then they're going to be fully engaged and, as she said before, advocate for themselves. Thank you.
Interesting. So diabetes is not something we should play with. It's not something to joke about with, because from what you're saying, you could end up potentially losing a limb, a toe, a finger, and things like that. Now, say I come to you, or let's say I meet you in what do you call it? The grocery store, Stop and Shop, any of these places. Dr. Kindana, this is to you, right? And then through conversation, I say, I don't know why, but lately I feel like going to the bathroom to do a number one often at night. I find myself very, very thirsty. Okay. And I'm losing weight. I'm happy I'm losing weight without trying. I'm not doing anything, but I'm losing weight. But you know what? I'm always hungry. I always want to eat something. There are times when I have blurry vision, and occasional I have numb or tingling hands or feet. I feel very tired. I think that's due to working so hard or my age. And then I noticed I have dry skin. Right, Dr. Kindana, from this conversation, can you tell me something? What does this mean?
Well, I think you've listed them all. Those are all telltale signs that that person may have diabetes, or that it might even be getting worse. So I can't tell you how many patients, for example, that has told me that, oh, people were um congratulating me that I've lost a lot of weight. But we call it unintended weight loss.
Right.
So if you're not going to the gym, you've not changed your diet, you're not doing anything differently, and you losing weight, that's not normal. So that should be a red flag that you need to find out
Must be
what's going
five
on.
radio.
And when you talked about the excessive thirst, excessive hunger, excessive urination, those are what we call the three P's. So those are classic symptoms of diabetes, unhealing wounds. And even for people, sometimes they may have what we call acanthosis nigricans, and this is where they have like dark velvety patches in folds and creases in their body. It often shows up on back of the neck. And I've even heard a patient one time tell me that they used to beat their daughter because they thought they just were not scrubbing and cleaning properly, not knowing exactly, and yeah, it's under the, like I said, back of the neck or under the breast for women and even men, um, be, um, between your arms by the elbow or
Mm-hmm.
even under the armpit, you might see this dark velvety patches. Those are also telltale signs. And yeah, urination, it depends on what's going on. It's so you still always have to get tested, because you mentioned prostate cancer when
Right.
we were doing the intro. So
Right.
a man can have enlarged prostate and be having frequent urination. Women also have other bladder issues that can lead to frequent urination. So it's not about making assumptions, but rather to go check it out, and um, also have the doctor make proper diagnosis. And I just want to also share another story about neuropathy, people not feeling any sensation. I went on a medical mission one time,
Okay.
and so we were doing the teaching in the group and stuff like that, and I was telling them about how they may not have feeling sensations on their feet and the type of shoes to wear. And this lady said, "Oh my goodness, now I get it. I she, in Africa, of course, they wear slippers a lot because it's hot.
Mm-hmm.
And she said one day she was walking and she was far gone before she realized she didn't have her slippers on. She didn't even
Oh.
know her slippers had fallen off her feet because she no longer had sensation on her feet. So we should not ignore any of these symptoms, even if it's suspecting of whatever diabetes or any other thing. It's always important to go get it checked out. Even if you don't have insurance, there are lots of clinics that prorate costs based on income. There's a lot of doctors that would that actually kind of reduce the amount they charge for cash paying patients. So whether you have insurance or not should not be a reason for you to not go and at least get checked out when you feel your body is not really working normally as it should.
Whoa. Thank you so much. Thank you so much, Dr. Akindana. I have a question from a listener. The question says, why is there a correlation between weight and diabetes?
Very good. I will use a word in my language. I speak Yoruba. So,
Okay.
you know, back home we say lorries, which are like trucks here. I
Right.
think here there are more rules about how much weight a truck can carry. But back home, we all know that we call it aderupoko. Aderupoko is like the truck has been overweight with the luggage or whatever it's carrying. And
Okay.
if you can picture that, you start to see the car itself starts to settle onto the tires, right?
Mm-hmm.
Of the car, almost want to drag on the floor. So it's similar. Our body kind of almost runs like a vehicle, believe it or not. So when we are overweight, we are already designated with the size, right?
Right.
Height, and your body's structure. And with that, God is good, has perfected what your heart size should be and all your other organ sizes should be, including that pancreas. But when we start to gain weight, that means we are tasking our body to do more and tasking the organ to do more than it has naturally been created to do. So this is part of the reasons why things start to fall apart. It's not just with diabetes. Even you see people who are overweight, they could barely walk 10 steps sometimes and they're out of breath. Because why? It's too much weight and the body is not able to oxygenate properly because of that excess weight. So it plays a role in all aspects of our body.
Okay, thank you so much. And I just learned something quickly. Dr. Akindana, Ekasa.
What did you say?
Ekasa. Did I say it
Oh,
well?
a castle. Okay, good afternoon. Yes. Very good.
Thank you,
And,
thank
and
you.
Teresa, tell them the one that you know.
No wahala.
Ah, Teresa, thank you for that. So
And please.
we're having this discussion about diabetes so that later on in life there will be no wahala.
That's
Yeah,
right. There you go.
Okay,
that
so I have a scenario here. I have a scenario. I've been told my sugar levels are high. My glucose is high after going through a test. So what is next for me? What do I do? Do I just leave my doctor and head straight for the gym? What is my journey? My sugar is high. I'm diabetic. What happens next?
Well,
Dr. Kindana.
that is a fully packed question.
Okay.
I mean, like anything else, when you or any disease for that matter, when you're given a bad news like that, um one might feel dejected, one might feel overwhelmed, one might not know exactly where to start. They may start to think of the worst scenario, right? Worst case scenario of
Right.
what's going to happen to them after that. But the good news about diabetes, as difficult as it is that it is a manageable disease. So that is the good news. And if one is diagnosed early, it might actually be caught when that person has pre-diabetes, which is reversible when you have pre-diabetes. What are the main things that one needs to do? The guideline, ADA, American Diabetes Association guideline, says that lifestyle plus. So changing one's lifestyle, you cannot continue status quo of eating whatever you want, how much you want, junk foods and sodas and juices and alcohol and all of those things in excessive amounts and consumptions.
Right.
Um, but again, it's about lifestyle changing your behavior, adding exercise into your routine. And it's amazing actually, if one eats and don't one just gets up. I call it working for your food. I tell my patients, when you're done eating, you could go for a walk for 15 minutes. And it's
Okay.
amazing how they see their blood sugar, instead of it to continue to rise, it starts to come down. Now, depending on where that person was in terms of their A1C or even their blood glucose levels,
Right.
they might also need to start on medications. For patients who have type 1 diabetes, their body does not really make insulin, so they have to be on insulin for the rest of their lives. It's basically a lifesaver. Prior to um, insulin being discovered about 100 years plus ago now, people used to die with type 1 diabetes. They become emaciated. Even though they keep eating, their body is not able to utilize that food as a source of nutrient to their body. And
Right.
then they die. But with the advent of insulin, we've been able to save many lives of people living with type 1 diabetes. With type 2 diabetes, we have a lot of other options. I call them arsenal in our toolbox, which
Okay.
could include taking oral medications, and now we even have new medications on the market that helps with weight loss, that does not cause low blood sugars, which is often the reason why sometimes people don't want to take their medication. They don't want to experience hypoglycemia, which
Right.
is low blood sugar. They have non-insulin injectable medications, and I'm sure there's the craze now in America. So many people have heard of Ozempic and
Mm-hmm.
um, Monjaro and Victoza. So many of all these drugs, they are injectables, but they are not insulin, and they help control um, the blood glucose. But not only that, they also help with weight loss. So for a change, the side effect of these drugs are actually beneficial to that person. So it's a good side effect. And then there are some patients who just outright, and like Teresa said, by the time they come to us in the hospital, you know, they're not pretty in bad shape, for lack of a better word.
Right.
And so we might have to discharge them home on insulin. They may or may not require to be on that insulin for the rest of their lives. And I often hear patients trying to negotiate not being on medication, and I tell them it's a means to an end. Your numbers would determine if you need to be on it. Numbers don't lie. If you're taking too much medication, you're going to have low blood sugar. If you're not taking enough, you're going to have high blood sugar.
Right.
So we're not trying to push any drugs on any particular person,
Mm-hmm.
um, but rather to control that number. And that really is the bullseye, is that blood glucose number, that blood sugar number. It's what's going to determine what trajectory that person is going.
Yes.
Interesting. Interesting. This question goes to Teresa, right? I've been diagnosed that I have diabetes. Okay. Are there stages of diabetes? Let's say there's a stage one, stage two, stage three, and all of that. And also, does diabetes cause cancer? This is for Teresa.
Okay. Okay. Thank you. Um, so if we take a couple steps back and talk about somebody's blood sugar that does not have diabetes,
Right.
you prick their finger before they eat, their blood sugar will be between about 70 to less than 100. And after eating, within about 2 hours, that blood sugar is not higher than 140. So that's the blood sugar of someone with a fully functioning pancreas. As type 2 diabetes begins to develop, they can move into a stage known as pre-diabetes. And that's where the fasting blood sugar, if you prick the finger before eating, that blood sugar is going to be a little higher than 100, but it's not yet going to be at the level where diabetes is diagnosed, which is, I believe, about 126 before eating. And then after eating, their blood sugar will also tend to stay higher longer. And
Okay.
then if it's not arrested in that pre-diabetes stage, if nothing is done and the person moves into diabetes, at that point it is not reversible. So rather than stages, I would say no diabetes, pre-diabetes, and then diabetes. But just like Dr. Akindana said, once you are diagnosed with diabetes, you can still live a very long and healthy life, but you must manage it and get that blood sugar level into target, which is about 90 to 130 before meals, no
Right.
higher than 180 2 hours after meals, and between about 100 to 150 before bedtime.
Okay. Now, does diabetes cause cancer?
Does diabetes cause cancer? Dr. Akindana, I might ask you to jump in on this. I have not heard of a direct corollary, but I have heard that it can increase the risk of cancer. And now I would like to pass that to Dr. Akindana to address.
Okay. Dr.
I think
Kindana.
you answered that appropriately. It does not necessarily cause cancer and cause diabetes. But there may be some correlation, probably because of some of the medications that they're on. Maybe they're on steroids at some point. Of course, they have, under a lot of stress as well, and as can be imagined when they're diagnosed with such a disease. So some of that could cause them to have diabetes. So we call sometimes because of a medication, we call it a drug induced diabetes, but it's still nonetheless treated the same. And once they've developed that diabetes, it really doesn't go away. So, unfortunately, and sometimes people say, "Oh, I don't want to take this medication because it's going to do this and that, or because of the side effects and things." But if you have cancer, um, it's pretty much almost a deadly disease compared to diabetes. So yes, they might give you some medication knowing that it may cause diabetes down the line, but we're looking at the risk versus benefit at that point. That
Right.
even if I was to give this person this medication and they develop diabetes, I could manage that. But if I don't treat the cancer, then the chances that they would die is a lot higher.
Interesting. So, Dr. Kindana, once diagnosed that I have diabetes, can it be cured, reversed, or will I die? I'm doomed.
So, I mean, we used to say there is no cure for diabetes. Um, and there still really isn't any cure actually for diabetes. There's a lot of research being done. But I've had quite a few of my patients pay exorbitant amount of money in the thousands, with the intention of reversing diabetes. So there is what we call reversing diabetes, but not as people tend to define it.
Okay.
Diabetes can be reversed. Say if an obese person, for example, has bariatric surgery, and so um, the bariatric surgery itself kind of, and I don't know all the technicalities around that, but for lack of a better word, it kind of recalibrates that person's body.
Okay.
And they're eating a whole lot less because their stomach is a whole lot less and things like that. And so they may be in remission. So that's the word that we want to use rather than reverse per se.
Right.
So, but if they go on and start to eat again and gain weight, they're going to be right back where they started from. And then there's a lot of all these fad diets going on, of no carb diets, low keto diet. This, and I'm not knocking any diets, but people need to understand what that means. That
Mustbe5
while you are
Radio.
engaging in those diets, yes, your numbers may be normalized, and then when you go to the doctor and they say, "Oh, your A1C is, maybe 5.2 or something," and oh, yeah, that means I don't have diabetes. No, incorrect. That means you are in remission, because if you stop doing what you're doing, you're
Right.
going to be right back where you started from. And the diabetes might even come back worse, because at that point, many people are not even paying attention. They just think that, "Oh, I'm cured, I no longer have diabetes anymore." And I've had quite a few patients like that did not know. One of my patients actually said to me, "Oh, my doctor told me I no longer had diabetes, and I was acting like a kid in the candy shop." She just was living her life,
Right.
eating whatever.
Right. Interesting. Interesting. Thank you for that information. Teresa, this goes out to you. So, I've been diagnosed that I have diabetes. How do I test my numbers if I'm home? Is there a way to test, or do I just go by, I don't feel good today, I feel like my sugar is low? How do I know what my numbers are?
Well, if I was meeting you in the hospital and
Right.
you have a new diagnosis of diabetes,
Yes.
what I tell people is that you have three assignments while you're in the hospital, and
Okay.
then 3 assignments once you leave the hospital. And people that do those assignments, that blood sugar tends to stabilize within a couple after leaving the hospital. So the first assignment in the hospital is you need to learn how to check your blood sugar.
Okay.
Dr. Akindana always says if you're not checking your blood sugar, it's like you are driving down the road blind. And there are people that will say, well, I can just feel when it's high or feel when it's low.
Right.
So we always tell them verify it because it may surprise you. So the first thing we'll do is make sure you have a glucometer when you leave the hospital and that you know how to use it. For people without health insurance, you can get the supplies you need to prick your finger and check your blood sugar for about $26 at Walmart.
Okay.
For people that do have health insurance, the doctor will just write a generic order for a glucometer, and the pharmacy will give you the one that's approved of in your plan so your out of pocket costs are low. Ideally, you want to start checking that blood sugar before your meals and bedtime, which is 4 times a day.
Right.
And we do give them their targets. For those people that say that is just not realistic, we'll say the minimum is before your breakfast and in the evening. And it also depends on when you take your medication. If you're going to be going home on insulin therapy, anytime you give yourself a dose of insulin, you must know your blood sugar first. So if you go home on 4 doses a day, you will be checking your blood sugar 4 times a day. They have new technology now where we actually have a hospital to home program, and
Right.
we can put the Freestyle Libre on patients' arms. That stays in place for 2 weeks, and they can use their smartphone as a reader, and they can get their blood sugar all day long. And that has been a real game changer for patients.
Well, you did
Interesting.
mention they wouldn't have to prick their fingers, so that's the good part of that still.
Yes, yes, and there was one patient that was actually phobic about needles. So, telling him about the Libre made all the difference in the world for him. So, you do need to check your blood sugar. You must turn on the headlights of the car. You must know where you are and where you're
Right.
going.
Interesting.
And if I could just put a plug in, both for Abbott, they've been very gracious to us to give us the Libre. It's called a continuous glucose monitoring device
Okay.
that you put on your back of your arm. There's been a lot of commercials of this on TV, and all you have to do is scan it, and it gives you your numbers. And they actually have a new one out called Libre 3, where you don't even have to scan anymore. It just shows up on your phone, and you can see your numbers in real time. They do have a program. We don't want you to come to the hospital before you participate on their website. So if you look up what do I call it? Freestyle Libre. You answer the questions, and they are giving out a free um, device so that
Right.
for it's good for 14 days. And then there's another company as well that is providing similar service, and it's called the Dexcom, Dexcom, and M as in Mary,
Right.
and it's also free. You could do a trial, and so if you like it, if it's covered by your insurance, you can have your doctor write a prescription for you, and you continue to receive it. Unfortunately, a lot of these things, insurance still requires people need to qualify one way or the other before they pay for it,
Right.
but they are making them a lot more cost effective, where the patient can afford to actually buy it out of pocket. And you don't have to use it all the time. You could use it just maybe, I mean, when you wear one of them, it's good between 10 to 14 days, depending on which one you get. So
Okay.
it gives you a lot of information within that time period
Right.
of your blood glucose numbers, how it's responding to food, to exercise, to stress, sleep or lack of sleep, and different things like that. Um, so you begin to understand. how these things impact your body.
Right.
Or if one is sick, one could use it. If the doctor is changing your medication, you could get on it again. So if your insurance is not covering it, you can still participate in using that at intervals when there's some changes going on with your disease process.
Thank you so much. We usually take a musical break, but the conversation is intense and we need to get as much information out there. So I'll skip the musical interlude for now. Dr. Kindana, so I have low sugar, right? I feel like I'm going to pass out. And usually what I do is, well, I'm already a diabetic. So I know that once I feel, like I'm going to pass out, I need to take something, maybe orange juice or something, right? Now, you can correct me if I'm wrong, but I'm going to bed, but I feel like my sugar is low. What should I have by my bedside so that later on, if I wake up, I do a check, you know, and I see that my numbers are so low? What can I take to boost it,
Okay,
Dr.
that's a
Quintana?
very good question. But first, I should say, if you're going to bed and you kind of feel like your blood sugar is low, the
Don't
first
go
thing
to bed, right?
you should do is check to confirm. And don't just go to bed. So
It might
that,
it might be
that
your last sleep.
exactly, and we don't want that at all,
Right, right,
because people can actually go into coma and people could die from low blood sugar. And like I explained to my patients, I equate it again to your car. We have that signal in the car that comes on the red light or orange light that lets you know, okay, your gas is getting low. It's not
right,
empty yet, but it's getting low, right?
right,
So what is it telling you? Get to the next gas station. But gas is kind of expensive, and I know if I could just make it to Costco, I'm gonna get 50 cents less, so I'm not stopping.
right,
And then on mine to Costco, your car stops, and we see those people on the highway, right? We
right,
see them
right,
running around with their red jerry can trying to buy gas. So
right.
it's the same thing with our body. If you feel symptoms, and what are those symptoms? For example, you might feel lightheaded, you might
Okay,
feel shaky, you might feel sweaty, clammy, nervous. You might even have a hunger bang, kind of like you just feel so hungry and your belly hurts.
okay,
Um, so all those things, you know, are telling you that, oh, you need to do what? Check your blood sugar. So those are kind of like your red light in your car telling you something is happening and you
okay,
need to check on it. Now, what are things you should have not just at your bedside, but also even in your car and on your person if you have diabetes? Um, is things you can have hard candy. They have glucose tablets. If you are taking hard candies or glucose tablets, then at least three or four of those. Um, you could have like glucose gel. You could have half a cup of juice. And when I say half a cup, is about 4 ounces. So not, people sometimes would drink a whole, almost the whole gallon of juice, trying to, resolve how they feel because they do tend to feel lousy when you have a low blood sugar. So,
right.
but either a half cup of juice, a half cup of regular soda. So that's not the time for diet soda,
Okay,
or even you could do milk as well, half a cup of milk. So all of this can help you. They also have other medications now on the market called glucagon if that person is unable to help themselves. So their family can also administer that glucagon to them that can bring the blood sugar high, and of course at that point they would need to call 911.
all right,
The key is not to skip meals when you have diabetes, even though a lot of it is around food, but it's really important that you eat. And if I'm going to be a little bit technical, we have what we call the 15-15 rule. So 15 grams of carbohydrate every 15 minutes until you're able to resolve the low blood sugar. And what is low blood sugar? There's a definition for that. That is blood sugar when you check it, if it's less than 70, that means you're actually having a low blood sugar, or the medical term is hypoglycemia. You're
Okay.
having a hypoglycemia event, and you treat just as I said earlier. If it's less than 54, then that person is having a severe hypoglycemia event. Um, and then, so like I said earlier, though, you take 15 grams of carbohydrate, so which is all what I had explained in terms of the portion of the juice or soda or candy or whatever. You
Right.
wait 15 minutes and then you check again and see if that number has come above 70. If it has not, then you repeat again, taking 15 grams of carbohydrate,
Okay.
and you wait 15 minutes. Even though you are feeling lousy, doesn't mean, again, like I had said, that you should over treat, because what ends up happening is you go from low and then now start to find yourself in with high blood sugar. It could go even as high as 300, and you don't really want that.
Right. Right.
Once your blood sugar is above 70, if it's time to eat, then you want to eat something, because if you don't eat something, it's going to drop again. And if it's still a while to your meal time, then you want to have a snack, so that, maybe like a little carbohydrate and with some protein, maybe like a half a sandwich or something like that, or
Right.
some crackers with cheese or something like that. And last but not least, that I would mention, um you might find that you're having low blood sugar either because you skipped meals,
Okay.
you delayed eating, or you're taking too much medication. So if that's the case, you need to correct that. Eat on time, right? Don't skip meals. Eat enough food as you've been instructed. Uh, Um, but if you're having such an event at least 2 times or more a week, you need to definitely get in touch with your provider, because they may need to adjust your medication. Maybe you were doing some things right, okay,
Right. Right.
where you've lost some weight, and so now you don't need all that medicines anymore. You're making better choices with your food. You're exercising regularly, at least 150 minutes in a week. All those good lifestyle changes, you've been doing them, and so you don't need as much medicine, and that might cause you to lose weight because that has not been adjusted. I mean,
Okay.
to have low sugar rather, because that has not been adjusted.
I see. Dr. Kindana, you mentioned medications. We haven't really talked about medications. What medications are available to help manage diabetes, and are there any side effects?
um Most medications would have some side effect or the other,
Okay.
um but many of them are manageable. Many, sometimes you don't experience it, it just depends. For example, if that person is on insulin or some medications that we call sulfonylureas, so say the person is on something like glipizide or glyburide or glimepiride, even though they are pills, they are not insulin. The job of those oral medications is to make the pancreas release more insulin.
Okay.
So the side effect of insulin and those type of oral medications is that the person is at higher risk of having low blood sugar.
Right.
And that's again why I said, if you experience that, you need to let the doctor know, because then they can adjust your medication. If it's that you're not eating well or you don't know what to eat, then you want to meet with a dietitian that can educate you on what to eat, how much to eat, so that to reduce those risk of low blood sugar. Another medication that is very common, is the number one widely used drug to manage diabetes, is something we call metformin. It's
Okay.
very cheap. You could get them at, under $10, and even as low as $4 at Walmart.
Is it by prescription?
Yes, it is by prescription.
Okay.
It is by
Okay.
prescription.
Okay.
Um, and those usually just have more side effects related to the GI system. So that person might have maybe feeling bloated, they might have some diarrhea, and things like that. But those particular those symptoms are what we call transient, is when your body's kind of getting used to it. It usually goes away in about a week or two. There are very, very few people that cannot tolerate metformin for the most part.
Okay.
The way to reduce those symptoms is to make sure that you are taking that metformin with your meal. If you take it with food, you will decrease those GI symptoms. Okay,
All
if
right.
you're going into third week, fourth week, and you continue to have the loose stools or bloatedness and things like that, then you need to let your doctor know so they can investigate. Maybe you're just not tolerating the drugs. And then we have a lot of new novel medicines on the market. They are what we call some. I mean, I've talked about the non-insulin injectables that help with weight loss.
Right.
Many of them are either taken once a day, and the newer ones are taken once a week. Um, and the way those work is it allows the brain and the stomach to communicate better, so that that person can hear that they're fuller, because that's why people tend to overeat, because they don't know that they're full until they have to unbutton their pants or their belt or something like that.
Right. Right.
So it also increases what we call satiety, which means a sense of fullness and satisfaction.
Okay.
And because of that, you're eating a lot less and you feel satisfied. You are not digesting the food very quickly, so
Right.
it stays longer, and then you're eating less. They are not without their own side effects. If you are feeling any, say, like vomiting or abdominal pain, nausea, you want to, let your doctor know, and they can see. One of the biggest side effects of that is pancreatitis, but there's an
Okay.
easy test they could do to see if that person has pancreatitis or not. The only other concern with that drug is it's patients who have history of some thyroid tumors, the C thyroid tumors.
Right.
Um, so, and the doctor would ask you those questions before they put that patient on that, just to make sure there is no history of that. So, those are the patients that is kind of contraindicated.
Okay.
And last but not least, which there are many, many more. I think there are like, if I'm correct, maybe like 14 different class of medicines of diabetes that one can use. But um, one of almost I want to call the miracle drug that's out more recently is it's a tablet, and they are called the SGLT2. And those kind of works on the kidneys. So glucose is filtered from our kidneys, and that's why again people might end up with uh complications with their kidneys if their diabetes is not well controlled.
Okay.
But with this
Okay.
particular medication, it works on the kidneys to empty out um excessive sugar that that person may have consumed, so they might find themselves going to the bathroom more.
Right.
um but it doesn't have any hypoglycemia, so it's not associated really with low blood sugar. It helps with weight loss as well. And the bang for the buck is that it also protects the kidneys and it also protects the heart, so reduces risk of heart disease and cardiovascular accidents. So it's almost the new aspirin for diabetes care. And with those drugs, we have to be careful if you are having what we call UTI, urinary tract infection, because you need to drink lots of water because it's helping you excrete excessive glucose.
Right.
So that can become a cesspool for infection. Um, we and more other complicated things like diabetes ketoacidosis might occur in patients with type 1, for example, if they're on that medication, or even with men, they may end up having um some kind of disease on their private part and things like that. But again, not to say these are going to happen, but these
Right.
are things that you should look out for and alert your doctor if you were to experience any of this. Most important is drinking a lot of water when you're on those medications to flush your system.
Thank you so much. We try to keep this within an hour, but I'm still getting
Yes.
questions from listeners, and I'm sorry we've extended past the 1 hour. We'll try and cover a few more
Isn't it
questions.
funny when how time flies when you're having a good time, isn't
It
it?
is. It is. It is. I'll take this one to Teresa. I believe you mentioned it earlier on, but how often should I check for my blood sugar levels, and what is considered the normal range? This is for Teresa.
Okay. How often you would check? Ideally, we do ask people to check when they first wake up in the morning,
Okay.
before their lunch, before their dinner, and at bedtime. But it does depend on the treatment that the doctor has ordered. So if you're going to be going home on insulin, you would be checking before you ever give yourself a dose. If you're going home on a medication like metformin, the doctor may just ask you to check once a day or twice a day. So the doctor will let you know how often to check. And when people are pricking their finger, they'll tend to do it kind of the minimum because it's a bit inconvenient and it's uncomfortable, which is why we really love those continuous glucose monitors because then people will be checking their blood sugar all day long.
Okay.
Your target is between 90 and 130 before you eat a meal. Within 2 hours of eating a meal, that blood sugar should not be higher than 180. And at bedtime, the blood sugar should be between 100 and 150.
Okay.
After a meal, if that blood sugar is higher than 180, you can start problem solving. Did you eat too much sugar? Do you need to drink more water? Could you go for a walk? So the more you check your blood sugar, the clearer the picture you have as to what's happening inside your body. And
Right.
then you can start to make little changes in your day. And that's why the more you check, usually the more successful people are because they'll see, oh, my blood sugar is too high. Let me drink some extra water. Let me go for a walk. Let me, not have as many carbohydrates as the next meal. So they're making these little changes throughout the day.
And
So
if I could add to that as well, before
yes,
you
please.
ask your question, is something that is very important that often is lacking is actually uh, m- get meeting up with a certified diabetes educator
Okay.
um, and care specialist because they specialize in managing diabetes, in educating you how to manage diabetes. For the most part, most patients see a doctor for 30 minutes in every 3 months. So
Okay.
all the choices and things that one should be doing to take care of themselves are decisions that has to be made um, by that particular patient. So seeing a diabetes care and education specialist, and again, that person could go online and Google diabetes care and education specialist in my area, and they should go and see that person. When you're newly diagnosed, you should go. If you're having difficulty or you've been doing well, but all of a sudden you just don't know what's happening, you should go. If the doctor is changing your medications a lot, you should go and
Okay.
see a diabetes care and education specialist. If you were recently in the hospital, um, and you is also a good time. So you're newly diagnosed, or again those um, reasons that I mentioned earlier. Another important person is seeing an endocrinologist or a diabetes specialist like myself, or either a nurse practitioner or a physician assistant that has spent their career specializing in caring for people who has diabetes. So it's good to go see a specialist. People see cardiologists, people see urologists, and podiatrists and all of that. There is also a diabetes specialist doctor called the endocrinologist,
Right.
who are physicians, or a diabetes specialist like myself, who are nurse practitioners.
I see. Thank you so much.
Great.
This question from a listener says, how can I prevent diabetes related complications such as neuropathy, kidney disease, or retinopathy? Should I go over that
Well,
again?
yeah, well, those are definitely long-term goals. It's is for the duration, for the whole of your lifetime. So
Okay.
there is no, I could do something now and then I never have to worry about it again.
Okay.
No, you could because if again, like we've been saying, if you take your eye off the ball, things will start going in the wrong direction. So how can you prevent them? Number one is controlling your blood sugar. It's
Blood
not which
sugar.
medicines you're taking, is controlling your blood sugar. Now, how do I control my blood sugar? The medicines I'm taking, losing weight, eating right, exercising, sleeping
Walking.
well, reducing stress. Yeah,
Right.
it could be walking, water walking. If you have joint issues, back issues, and overweight, and you can't go too far, 20 minutes water walking in a 3 feet pool is same as walking an hour on ground, right?
Okay.
Bicycling, whether it's stationary bike or otherwise. So if you know you're not going to go to the gym, don't pay for it. I told my husband, don't pay for the gym some
Right.
years back because I'm not a gym person. Even though I do go now because I
Right.
have a trainer, so she keeps me in check. But prior to that, I don't go of my own accord. So don't waste your money buying a treadmill if you know you're not going to use
You're not
it.
going to
You
use
could
it.
turn on
Right.
YouTube and you could, there's tons and tons and tons of exercise on YouTube, whatever rocks your boat. So we're
Okay.
not partial to any one form of exercise or the other, as long as you keep moving. That really is the key. And then also keeping your appointments with your provider is really very critical.
Right.
Now, people say, "Oh, I keep going every 3 months." They're not doing anything. Um, if you're doing well, and you should ask that question because it goes both ways. I've had patients who go every 3 months and things are not well, and the provider did not change anything. So
Right.
at that point, you need to advocate for yourself and speak up and say, "Well, my blood sugar, I was told on this radio show it has to be certain number, but why is mine in the 300? And why are you not doing anything about it?"
Right.
Right?
Right. Right.
And if they're not doing anything, you might need to consider, should I go find me a different person who will be more proactive with my care? Because the only person who is going to suffer is you. So that's really very important that you keep your appointments. They are doing your A1C. When you go for that lab test, they're checking for your cholesterol. That's another thing. You most likely you'll be on cholesterol medicine. You might be on high blood pressure medications. You might be on medications to help with the neuropathy, keep the noise down. You want to make sure, you might need to see a podiatrist if you can't reach down to your feet to put their own toenails.
Right.
Good foot care. When you go to the doctor, clean your feet. But it doesn't even matter if you stinky, they're getting paid anyway. Take your shoes off, take your socks off, and tell them to check your feet. They could, with a
Mustbe5
simple test,
Radio.
see if your nerves is still working. Pain is a good thing. God put it there for a reason, for
Right.
you to know when something is happening. So if
Right.
if, if you don't feel pain, that should
That's a
be a
problem.
red flag. Like I
Right.
should run and go see somebody. Like, oh, I carried a hot pot. I had a patient once who used to just carry things off the stove with her fingers, and she didn't feel any pain, and she was so proud of. Oh, I don't feel nothing. Well, but that's nerve damage. That's why you don't feel nothing.
Right. Right.
And unfortunately, by the time she came to the hospital, they had to amputate some of her fingers because
Ooh.
they were necrotic.
Mm.
Wow. Thank you so much. Final question to you, Dr. Akindana, and then one final question to Teresa after that, and then we'll wrap this up. Dr. Akindana, how does diabetes affect my work and family?
Your work and family?
Yes.
Tremendously. Tremendously. So diabetes actually affects even one's earnings sometimes,
Okay.
because if they are sick, they might not be able to go to work. It may affect productivity even at work where you are calling out frequently.
Right.
People might end up with disability. And with your family, if you're sick, then that means that they have to take care of you. It is managing diabetes. If there's someone in the family who has diabetes, should be a family affair. So
Okay.
it's not right that you buy fried chicken from KFC, and I'm not knocking KFC, please. Nobody should come for me, please. But maybe
You're
I'm saying
fine.
from a you're eating fast food,
Right.
junk food, and all these things, and then with the same tone, you're saying to that person with diabetes, "Oh no, your doctor said you can only eat vegetable." No, everyone in the family should be eating healthy. No, no buying of junk food and bringing home, because I always say that willpower is overrated. If it's there, you're gonna eat it.
Right.
And if you're someone like me, I had to learn about myself that I suffer from mindless eating. So maybe I'm just watching TV, like Netflix binging on a weekend, for example.
Right.
I might just find myself keep going to the kitchen looking for a snack or the other. About the third trip, I'm like, whoa, wait a minute, what you doing, girl? you know,
Right.
so, but the good thing is I food proof my house because I buy healthy snacks in my house. So
Okay.
even if you want to eat snacks, you need to buy healthy snacks and not junk food.
Right.
So and yeah, so that would help you as well.
Dr. Kindana, thank you so much. I'm going to try to speak your language again. Esheo, is that correct?
There you go. Adukwe. So
Aduke,
you say
okay.
thank you.
Okay. All right.
You're
Now,
welcome.
Teresa, final question to you. And the question is, are there any support groups or resources available to help manage diabetes, to help me manage my diabetes?
Well, one of the most important jobs that I have is connecting patients in the hospital
Okay.
with the resources in the community. In the hospital, you just teach them the basics so they can go home safely,
Right.
but they need to take something called comprehensive diabetes self-management education. And it is a standardized curriculum at diabetes centers throughout the country. So that is number one. So as soon as someone is diagnosed, they should ask their doctor or call the local hospital, ask if they have a diabetes center, contact the diabetes center and tell them, I want to take comprehensive diabetes self-management education. It's
Okay.
usually run by a dietitian or a nurse. And you can also see a dietitian separately. In fact, that's recommended. So do both. So
Okay.
that's a very important resource in the community. Um, if you have type 1 diabetes, there is a wonderful organization called Juvenile Diabetes Research Foundation, JDRF. They focus on people with type 1 diabetes throughout the lifespan, but they do also have a lot of support for people in that transitional period from teens growing into young adults. The American Diabetes Association is a wonderful resource as far as food and information. So they're located, and the national headquarters is in Virginia. So these are some resources. And as Dr. Akindana said, you see an endocrinologist in the community, take
Right.
that comprehensive diabetes class, and if possible, try the Freestyle Libre or the Dexcom. If you do those three things, you're going to be well on your way to understanding the disease and managing it well.
And
Thank you so much.
if I could just add to that, and I'm not
Yes.
knocking Dr. Google, is please avoid making Dr. Google your go-to person for things you need about diabetes. As
Right.
much as they have information, sometimes there are incorrect informations and contradictory informations, and even more so, you might, especially blogs as well. So even what that person is saying may be correct, but it's peculiar to that person. Everybody's diabetes is different, so you cannot assume that because one person is doing X, Y, and Z that that is going to work for you. You need
Right.
to see a professional, and there is a lot of counties now, the health department are also providing free classes, free courses, or at a reduced rate. They have grants and things like that. So there is definitely, with a little bit of homework, places that you could go. And I keep mentioning that because it's amazing the number of people that are uninsured or ineligible to have insurance, or
Right.
they're even underinsured, and they may say, well, that's not for me because I don't have insurance. There are alternatives, there are options out there, or you could even ask your primary care provider as well, where can I go? And that should be your responsibility to
Okay.
ask, where can I go to get more help? So just seeing your primary care doctor every 3 months for 30 minutes is not enough.
I see. I see. Thank you so much. Thank you so much. I'm filled with gratitude for you devoting your time. We've been talking for almost 90 minutes now. We estimated an hour, but the topic is in depth, and we had to go deep and discuss diabetes. Thank you so much, Dr. Adeola Akindana of the University of Maryland Capital Region Medical Center in Lago, and also Teresa English, also of University of Maryland Capital Region Medical Center in Lago, Maryland. I am so grateful. The listeners are so grateful for your time and sharing your knowledge and expertise on our forum. Thank you so much.
And thank you for inviting us.
Yes, thank you very much.
You're welcome. You're welcome. Thank you.
All right, stop. Collaborate and listen. Listen. Listen.